residents. These are two bills that we've been working very hard on for the last uh, couple of months since we've discovered the number of fatalities and uh, the tragic deaths that we've witnessed and the lack of communication between these nursing home facilities to loved ones, and a number of other issues such as the lack of PPE and supplies and the understaffing, and many other problems that we've identified that led to this tragic outcome. We've introduced two pieces of bills, and the first one, A10350, has been amended since we had a press conference with a number of lawmakers and AARP who supported this. Now we have the full support of our chair of the health committee, Dick Gottfried, who is also a co-sponsor of A10350A, which is a bill that would put in a monitoring and a system and protocols that would set certain triggers for the state department of health and the state to come in and transfer patients out of nursing homes or implement plans to take over if the nursing home facilities are not fit to protect and care for residents during a pandemic or emergencies. It also requires the nursing home facilities to report every single day of their PPE status, as well as staffing needs, and they're also required to communicate by law to the loved ones. Many of these policies are actually covered under the Nursing Home Bill of Rights, which was a federal statute that was passed in 1986, and it was also strengthened by state law in New York. Unfortunately, it seemed like during this pandemic, with the number of executive orders and confusing policies, the state of New York waived some of these fundamental rights that residents have, and as a result, there was a lot of miscommunication and mishandling, which obviously led to a number of people who passed away, which at this point is around 5,400 residents who died in nursing homes. But tonight, we wanted to focus on A10427. There are some questions that have been raised through various circles, and people are asking online about what this is, because whether you are a doctor or frontline worker at a hospital, or if you're a nurse at a nursing home, or a social worker, you may be confused of what this is all about, because the way that it's been framed by the state of New York is that if you are a volunteer, or if you are a doctor or a frontline healthcare medical professional, we've granted you a level of immunity from being sued during this time. This is a little bit misleading because, first and foremost, uh, hospitals are very different than nursing homes. Hospitals and the people who work in hospitals are tasked to deal with COVID 19, like pandemics and other emergencies. Their liability standards are very different than nursing homes. Nursing homes are not hospitals. Nursing homes, like I said before, uh, are given, or actually framed much differently. The residents are given fundamental rights that are much of higher standard to ensure that their care and their ability to be taken care of are at a much higher standard, even more so than a regular patient that's administered to a hospital. And secondly, during the pandemic, uh, the liability standard for hospitals are already much higher. And lastly, people if there are third party lawsuits, it's never to a worker or a doctor or frontline worker, but to the business itself. So, what's very troubling with what happened with A10 or with the corporate legal immunity that was put into our state budget, is that there was a clause in there that got snuck in, and this was not debated, this was not discussed, that gave corporate immunity to executives, to board members, and to the businesses and the big corporate chains that are behind nursing homes. And also, they've added specifically nursing home facilities to the immunity clause. So on March 23rd, there was already an executive order that gave this type of assurance to the workers that you're protected under the law, and as a frontline worker, we're going to apply a higher level of liability. This was done through an executive order by the governor. Now, the law that the governor proposed and that was implemented in the budget, it mirrored that executive order, but it added a number of different things that give corporations and nursing home businesses and their executives a blanket corporate legal immunity, a get out of free jail card, if you will. So the A10427, it will repeal Article 30D, which is the section of the public health law that was instituted during the budget, which is really about repealing the nursing home and business and corporate immunity. Everything else that's already in place, like because of the executive order, the doctors and the frontline workers, they will continue to have the level of protection. And again, even without it, hospitals are treated differently and their liability standards are much higher during a pandemic and an emergency situation. So again, this is not about hospitals and doctors and workers. This is about nursing homes. And lastly, under this law that we passed, this immunity, the doctors and the nurses and the staff, they are discouraged to actually file third party lawsuits if the businesses or the corporations that are in charge are not administering proper policies. So again, the message behind it is misleading. They made it seem like this is about the frontline workers and doctors, but really this is about a blanket immunity for these businesses, the private equity firms, the hedge funds, and the corporate chain stores that are running nursing homes, giving them immunity. So why is it important that we repeal this? We issued a report after looking at national data, a state by state data of all the nursing home fatalities, and cross reference them with the 12 states that give early corporate immunity during this pandemic. For example, New York, we reached the apex of the COVID-19 crisis, the curve, in mid-April. This immunity for nursing homes was handed out at the end of March, beginning of April, weeks before they reached the apex. So, what is the impact of this when the corporations that are running nursing homes were told weeks before the apex of COVID-19 that they had full legal blanket immunity? The results are very astounding. 76%, 76% of the fatalities from nursing homes come from states that have given out early corporate immunity. And 77% of the total fatalities in the country came from those states that give early corporate immunity to nursing homes. We've looked at number of different factors to determine if there is a correlation, if not a causation, of an early immunity, corporate immunity status that was handed out to nursing homes and nursing home businesses and their executives. Um, we looked at the death rate in the nursing home population, and try to cross-reference that with states that had legal liability. We looked at the absolute number of nursing home fatalities, and when you look at the absolute number, New York and New Jersey are have the highest number of deaths in nursing homes. And we also looked at the average deaths per facility by state, trying to see state by state facility uh, ratios versus population, nursing home population ratios. And regardless of what we did, it was abundantly clear that the states that give early corporate immunity status, legal immunity status to nursing homes clearly had higher fatalities. So New York obviously is uh, has different demographics, and we have density, we have people traveling. The size of the state seems much bigger. So we thought that by cross-referencing the policies and decisions made in California versus New York, as it pertains to giving early corporate immunity versus not giving early corporate immunity, and the outcome of those decisions, we thought that this would be germane to this discussion, to make people understand that early corporate immunity does have a significant factor in nursing home, especially nursing home that's business driven, making better decisions. Um, so from this study that we put together, comparing California and New York, we can conclude that California has slightly fewer nursing home residents, but more nursing home facilities, which could indicate more opportunities for social distancing and the ability to isolate seniors. New York's death rate in the nursing home population is more than two times the national average versus California, which is less than half. It's clear that California took an early and collaborative approach to supporting nursing home facilities, whereas New York took a very business friendly approach by granting legal immunity weeks before the apex of the COVID-19 pandemic. So the important policy lesson here is don't jump to save nursing home businesses during a pandemic, and adopt a collaboratively driven approach that empowers localities to make better decisions. One other important factor comparing California and New York is that both states took in or ordered nursing homes to take in COVID positive patients. So I know that this was also a big discussion and a factor that many people brought up. Like, yeah, it's obvious when you send COVID positive patients to nursing homes that are not equipped and understaffed to deal with this type of infection rate from spreading. Uh, it's not a good thing. These aren't hospitals. They're not prepared to take in COVID positives. But both states took on that policy, yet California, as of a couple of weeks ago, had 996 fatalities in nursing homes versus New York, which had 5,403. So the main difference between California and New York was New York gave early corporate uh, legal immunity to nursing home businesses and their executives, and California chose not to. So again, we are trying to get justice for nursing home residents. The immunity and the higher standard of liability was done without any third party input, without any public discussion, and it's not right. We It's one thing to be at the end of a pandemic or coming down from the pandemic, and to have open hearings and discussions about who did what and how did they perform, and if certain sectors deserve to be protected. That discussion could be done openly during a public dialogue. To have this policy put in unilaterally by the governor in the form of an executive order, and then snuck in language into the budget where none of the members in the legislature had a time or an opportunity to discuss this openly, is simply unacceptable. So that's why we're putting together this bill to repeal this section, with the understanding that, uh, again, that doing this for nursing home businesses had a direct impact in how they performed. And in fact, it might have even disincentivized these businesses to do more to care for their residents. I mean, just think about it, logically speaking. Why would you care when A, you don't have the staffing, you're under equipped, and now you're told weeks in advance that you can't be criminally charged and you probably will not be sued by third parties? Why would you invest more to buy PPE, to buy more beds, to hire more nurses to prepare yourself? They simply thought that they could get away with it because they had this immunity. Not all nursing homes, obviously, but those who made that choice led to tragic outcomes. And that's why, as we prepare for a possible second wave in the next few months, we need to get this right. And I think repealing this will send a strong message that you can no longer hide behind a corporate immunity clause while you make bad decisions on the ground for the residents who again have fundamental rights that we passed in the federal and state